Tell me a little bit about yourself. Like, how long have you been a massage therapist and the type of massages you do?
Okay, well, first off, my name is Linda Deck, and I've been a massage therapist for 3 years now. And the type of massages I do would be deep tissue massage, Swedish, reflexology, shiatsu, um, cupping, and sports massage.
Describe patterns of change throughout history in massage among different cultures.
Okay, history. Well, this is what I learned from school. I know that reflexology was developed by the Chinese and Egyptians, and shiatsu was developed by Japanese monks who were practicing Buddhism in China. And with the Western culture, I believe it started during World War I, where they had to do massages on patients who were suffering from nerve injuries. And of course, the Swedish massage was developed in Sweden.
What type of research methods did you use outside of massage sessions?
Um, well, the most common method would be YouTube. You can find so many videos on massage, and they show you like different techniques from other massage therapists, and also I can like use their inputs and opinions on how to work with different clients. And of course, I do use my books from school. I refer back to those all the time, and also like I like to look up recent articles, especially the scholarly articles or the peer-reviewed ones on clients with these different injuries that I have to work with.
Performing a massage modality, is it a skill or is it something you have to practice?
I believe is something that you have to practice because it is important to practice to perfect the modality and practicing on different people because not everyone is the same and everyone has a different body type. And also, some people may like a deep massage versus a gentle touch.
What are your values as a massage therapist?
Well, there are many values, but the most important one would be respect. It is important to respect your clients. And of course, you have to be kind, you have to be compassionate. Beside that, also sociable, communicative. Um, and another key one would be balance. Because if you, as a massage therapist, don't have balance in your life, then you're projecting your negative energy onto your clients. And that isn't good either because they can easily sense that. And going off of that, intuition is another important one because it's important to sense how your clients are feeling and sense if they're uncomfortable. And you can do this by their body language, by observing them. They can tense up, they can start perspiring. There are many ways to look at this, and it's important to do this with all your clients.
Do you have techniques to keep yourself focused during a massage?
Um, no, I don't have a technique in particular. I guess it's just through enough experience and practice throughout the years. I feel like it's kind of automatic now. Like I know what to do, when to do it, and how to do it. And just working on many different clients, it gives me more experience on like what to do. And it's kind of like multitasking now. Now I can easily work on a client and interact with them and just talk to them about anything.
What type of exercises do you use to develop your motor control throughout a massage?
Well, since I do 4 massages a day, I really have to work on my posture and my legs because I do a lot of leaning and standing when I'm massaging each client. So the exercises I do would be wall sits, squats. I do lunges. Also, jogging. Jogging is important because I it will increase my endurance. And also, a massage can take a toll on my body, and so I need to do the right body mechanics. So, for instance, if I'm doing a deep massage, I can't just use my arm to put pressure on my client. I have to actually put my whole weight into it if they want more pressure, or else I will injure my wrist or my shoulder.
Well, so you do 4 massages a day. So if you work 5 days, that means you do 20 people. So I think I know the answer for the next question. As a massage therapist, do you ever burn out?
Yes, so both mentally and physically. Well, the mental part, each client do have a story, and they pretty much go to each session to vent. So I hear so it is a little mentally exhausting, but it's interesting. But I have to keep up with each client individually, you know. And then physically, I do have to work on many different people, and each one has different level of intensity, and so it does put a toll on my body, and I would need a massage myself by the end of the day.
Okay. So researchers use 6 methods to assess, and they are questionnaires, interviews, observations, um, biochemical content analysis, and physiology measures. Do you, as a massage therapist, use any of these methods?
Um, yes, so I do use observation. I do look if they're limping. I do look for any kind of injury. And also, I look for contraindications, so such as varicose veins, any bruising, or cuts. Those are what I have to watch out for during their massage session. And questionnaire will be another method. Each client has to fill out a questionnaire before I begin, and what I ask is like, what type of illness do they have that day, and pretty much how they're feeling emotionally, and their medical history, and just their history and injuries.
Okay. Does massage change the heart rate in a client?
Yes, there was recent research that stated that a relaxation massage, pretty much like a Swedish massage, will lower heart rate.
Okay. How would you determine recommendations for your clients?
Well, it all depends on their injury. So usually I would recommend them to stretch. Well, stretching is very important. And of course, to do exercises to strengthen their muscles. And with athletes, more particularly, I would tell them to do ice baths just for any soreness they have after the game. And of course, I would recommend them to come back to me.
Well, thank you for your time, Linda.
Thank you.